Okay, so after my head-to-toe assessment, I'm going to call the doctor and relay to him the changes in the patient's status and what you would like the physician to do to help me. So what I would say to him would be, "Hello, Dr. Miller, I'm just calling you on some concerns found with the patient in room 254, Lester. Patient was unable to identify his birthday and not very responsive when asked questions. While assessing the lung fields, the two lower lobes seem to have congestion presented in them, so I find it important to schedule possibly a chest x-ray. While checking patient's reflex, patient was unable to push down or pull back with the foot. So during rotation, the other nurse stated that the patient had not gone to the bathroom since 2 a.m. and has no urinary output since. My shift has started, so the bladder is pretty distended, and I believe that a catheter could be potentially to relieve the urine retention." And then one last concern I found while assessing the skin was the wound from the operation presented goopiness and redness. The patient also stated that it was sore and tender to the touch. And then after my phone call and my shift report, once I'm done with my shift for my SBAR, this is what I said in my situation. Lester is an 82-year-old patient of Dr. Miller. He was admitted 6 days ago with a right knee replacement. He was scheduled to be discharged yesterday, but he spiked a fever of 39.6 Celsius, and he complained of body aches and chills. So they ran a COVID-19 test, and he tested positive. So Lester has been really tired the past few days, but he did respond well to the Tylenol he's been taking for frequent pain medication because of the body aches and surgical pain in his knee. So the background for Lester is an 82-year-old patient of Dr. Miller. He was admitted 6 days ago with a right knee replacement, as I already stated. He has a history of smoking cigarettes for 30 years. However, he quit 2 years ago, and he is type 2 diabetic, taking insulin. He is also allergic to Toradol. So the assessment that I found, patient stated name but not date of birth. Started with palpation of the head and neck and asked if there was any pain while assessing. Patient stated no. Palpated down arms, assessed warmth throughout, pink and smooth skin. Asked patient to squeeze hands. Patient was able to squeeze back for the nurse. Assessed patient's legs and feet. Warmth through extremities, pink and smooth skin. Checked for pulses in feet, and pulse was good, which was about a 2+. Checked capillary refill, good, which was less than 3 seconds. Asked to wiggle toes and push down and pull back with foot. Patient was unable to do this task. Doctor will be making a round to have a look at this. Assessed a heart, sounds good with no murmur. Assessed lungs, the two lower lobes appeared to have a louder sound found in them. Still waiting on the x-ray team to come and take these x-rays for the patient. Assessed urinary bladder was distended with no output, so a catheter was placed, and the resident has had a urine output of 130 milliliters since placement. Assessed the skin wound, presented with goop, redness, and patient grimace when touched. Wound was examined and cleaned with new bandage and sterile field. So some recommendations I have for this patient would be for the patient should stay well hydrated to increase urine output. Patient should work on breathing techniques to increase the chance of developing pneumonia if he has not yet. Patient should participate in activities to decrease the risk of a DVT. Patient should be assisted with every ambulation to reduce the risk of falls, which could lead to further complications, and follow up with vital signs and assessments to decrease the chance of further complications.